Good day everyone, my name is Geraldine Sulutan and the topic that I want to discuss are the process involving lactation and the disadvantage and advantages of bottle and breastfeeding.
Inducing lactation is begin in pregnancy when hormonal changes signal the mammary gland to produce milk in preparation for the birth of a baby. So it occurs the three main stages of lactation and of breastfeeding. First is the colostrum. So it is the first form of breast milk that is released by the mammary gland after giving birth. So the first released milk is nutrients dense and high in antibodies and antioxidants to build a newborn's baby immune system. So it changes the breast milk within 2 to 4 days after the baby is born. Next is transitional milk. Transitional milk comes when the mature breast milk gradually replaces colostrum. So it makes the transitional milk from 2 to 5 days after delivery up until to 2 weeks. So it may notice that the breast become fuller and warmer and milk slowly changes to bluish white color. Next is mature milk. A mature milk is contained of 1,000 different proteins that support a baby's brain and immune system. Alongside, it also helping her to grow. So, immature milk is also rich in micronutrients, vitamins, and minerals and trace up from calcium to cadmium to support a baby's development and their well-being. So, there are advantage and disadvantage of breastfeeding. So, for breastfeeding, there are many good reasons to breastfeed your baby. So, first, breast milk is the best and the healthiest food for a child. Why? Because breastfeeding provides a baby with variety of health and development benefits. So, the natural ingredients found in breast milk will help protect your baby from illness and diseases. However, it also continue to provide your child with better health as they grow. In addition, breast milk tastes good to a baby than formula milk. Also, the taste of the food of a mother is intake or eaten would pass along to a baby, which can diverse their diet right from the start when breastfeeding. Next is breastfeeding is convenient. So your breasts are perfect way to supply your baby with optimal nutrition at the perfect temperature. So there's no need to worry about preparing and heating formula. Also, they don't need to clean up bottle and cleaning up after feeding. So last is nighttime feeding are faster and easier. So when a mother is breastfeeding, they don't need to make a warm bottle in the middle of the night. Also, breastfeeding can also relaxing for a mother because it releases a hormone called oxytocin, and that will feel good hormones that promotes relaxation, and also a mother have a quality time to spend with his or her baby. There are also disadvantages of breastfeeding. So, a mother have less freedom. When a mother is breastfeeding, they always on call and a mother breast needs to be available for everyday feeding day and night. So, it can be exhausting, especially during the first few weeks when they will be breastfeeding a baby every 2 to 3 hours. Next is breastfeeding requires healthy lifestyle choice. So a mother have to think about their diet and lifestyle when they are breastfeeding. So a baby may have a reaction to difficult foods in their diet and may have to stop eating dairy products or unhealthy foods because it can causes harmful to a baby. Lastly, breastfeeding can be painful. This most likely a reason for breastfeeding because it hurts and might be harder for a mother as the first stage of breastfeeding her child, and it causes so much pain on women's nipple, and that causes a very painful to all mothers breastfeeding. There's also advantage of bottle feeding. So anyone can feed a baby. In this case, bottle feeding is other parents or other can feed a baby. So it allows the sibling, the father, and other family members to spend some time to feed a baby. Next is, it can be done in public. Bottle feeding can be done in public. Some moms are not comfortable with breastfeeding their babies in public. So if you don't want to expose your breast to a public area, bottle feeding is the way to go. Next is you don't have to worry if your breast milk supply is low. Many moms worry that their baby will remain underfed if their breast milk supply is insufficient. In such case, many parents resort to bottle feeding. It may ensure that the baby gets all the milk he needs to grow and develop. Disadvantage of bottle feeding. Formula milk is not as nutritious as breast milk. A breast milk has the nutrients that the baby requires to grow and develop. So, we all know that bottle feeding may increases the risk of obesity in early childhood. Next is preparing the milk for bottle feeding takes time and effort. So, a bottle feeding takes time. So, you need to wash and sterilize the bottle and pour milk into a bottle. And it's a lot of work to do. And also, improper sterilization can also put a baby's health at risk. Lastly, the bottle feeding may compromise your baby's immune system. So, they have studied shows that breast milk develops and improve your baby's immune system. So, we all know that the bottle feeding, on the other hand, doesn't contain vital and natural nutrients formula feeding a babies. Also, it carries the risk of developing certain illness like a chest, ear infection, urine, and also diarrhea. So, that's all my topic. Thank you.
Good morning, everyone. My name is Hannah May Tilson. I'm here in front of you to describe the process of birth. Labor, also called parturition, describes the hard work of delivering a baby. It specifically refers to the process which starts the uterine contractions, which cause cervical changes, which allow the fetus to be delivered vaginally and ends with the delivery of placenta. Labor typically begins at some point when the fetus is considered full-term between 37 and 42 weeks gestation. In the third trimester, before labor starts, a woman might have a plaque of mucus and blood fall out of the opening to the cervix, sometimes called the bladder show. Other times, the amniotic sac might rupture, sometimes called water breaking. Either of these can trigger the onset of labor and so-called true labor contractions. These guys have to be disguised from the milder and ineffective false labor contractions, also called Braxton Hicks contractions, or sometimes called practice contractions. Once they start true labor contractions, progress in frequency, durations, and intensity, and they can feel like waves that build up to a peak intensity and then gradually decrease. The contractions pull in the thick tissues of the cervix, causing it to efface or get thinner, also dilate or open up. So then, the fetus can leave the uterus and enter the world. From the moment three contractions begin to the baby's delivery, usually takes about 12 to 18 hours for a first-time pregnancy and about half the time for subsequent pregnancies. Although, as any mother knows, this time can vary a lot. Even though labor is a continuous process, it can be broken down into 3 stages. Additionally, this first stage subdivided into 2 phases. The first phase is the early phase or late latent phase, and usually lasts up to 20 hours or until the cervix dilates to 6 centimeters. At first, there are irregular contractions that occur every 5 to 30 minutes and last about 30 seconds each, causing the cervix to dilate from 0 centimeters to about 3 centimeters and the phase from about 0% to 30%. Then, regular contractions follow. They happen every 3 to 5 minutes and last about a minute or more. And this causes the cervix to dilate from 3 centimeters about to 6 centimeters and a phase up to about 80%. This marks the beginning of the active phase of labor, during which the cervix dilates from 6 to 10 centimeters and it phases to 100%. Contractions are very intense, lasting between 60 to 90 seconds each, with only 30 seconds to 2 minutes of rest in between, so sometimes they can even overlap a bit, with one contractions beginning before the previous one is done. Also, the amniotic sac often ruptures at this point if it hasn't already. Now that the cervix is fully dilated, we enter the second stage of labor, and this can be thought of as the pushing stage. During this stage, the critical thing is for the baby, in particular the baby's head, to navigate through the maternal pelvis, and this depends on the three P's: power, passenger, and passage. Power refers to the first four uterine constructions, passenger refers to the fetus, and passage refers to the route that the fetus has to travel through the bony pelvis. In fact, the relationship between the baby's head and the bony pelvis is so critical that human babies have evolved with amphibious skulls just so their head can be as large as possible and still successfully, safely make the passage through the pelvis into the world. Now, there are a few factors that determine how easy this passage is for the fetus. First is fetal size. The critical factor here is the size of the fetal head. Also, there's fetal attitude, which refers to the way that the fetal body is flexed, not its personality. When labor starts, the fetus is normally fully flexed, which means the chin is on the chest, and they have a rounded back with fixed arms and legs. In this position, the smallest diameter, which is referred to as a suboccipital pragmatic diameter, presents at the pelvic inlet. Larger fetuses and those that aren't completely flexed have more difficulty making it through the passage. Next, there's fetal lie, which describes the fetus's position in the uterus. A longitudinal fetal lie is ideal, by the long axis of the fetus, which is its spine, lies along the maternal long axis, the mom's spine. The fetus can also be transverse though, where the fetal spine is perpendicular to mom's spine, or it can be oblique where it's slightly at an angle, and this T position can impede the progression of labor. Finally, there is a fetal presentation, which refers to the first fetal part, called the presenting part to descent into the pelvic inlet. Cephalic or head first is the first type, and furthermore, the most common and optimal presentation for easy delivery is a type of cephalic presentation called vertex, which includes complete flexion of the head as well. Also, there is bridge presentation, which is head up, so the bottom feet are knees present first, as well as shoulder, with the shoulders present first. To make it through the passage, the fetus makes several position changes, which are called cardinal movements or mechanisms of labor. Initially, there is descent, which is the downward movement of the fetus into the pelvic inlet. The degree of descent is called the fetal gestation, which is described in terms of the relationship of the presenting part to mom's ischial spines. The fetus moves from the pelvic inlet, which is at about -5 stations, down to the ischial spines, which is station 0, and this position is called engagement. Then there's flexion, where the fetal shin presses against its chest as its head meets resistance from the pelvic floor. Next, there's internal rotation, where the fetal shoulders internally rotate by 45 degrees so that the widest part of the shoulders are in line with the widest part of the pelvic inlet. After the fetal head passes under the symphysis pubis, which is at about +1 station, there's extensions, which is where the fetal head pushes from flexions to extensions, and then they move to about +5 stations emerge from the vagina. After the delivery of the head, there's restitution, where the head externally rotates so that the shoulders can pass through the pelvic outlet and under the symphysis pubis. And finally, there's expulsions, where the anterior shoulder dips under the symphysis pubis, followed by the posterior shoulder, and then finally followed by the rest of the body. This marks the end of the second stage of labor. And third stage of labor occurs after the baby has been delivered and involves delivery of the placenta. After the baby is delivered, the uterus contracts firmly and the placenta begins to separate from the uterine wall. It's then carefully removed to ensure that there are no placental remnants left in the uterus. Sometimes, several hours after delivery is called the fourth stage because there are major psychology exchanges like adoption to the bloodlust and the start of uterine involution, where the uterus begins returning to its pre-pregnant stage. Alright, as a quick recap, labor is composed of 3 stages. The first stage starts with 3 labor constructions and ends when the cervix is completely effaced and dilated. The second stage is the pushing stage, which ends with the birth of the baby. The third stage ends with delivery of the placenta. That's all, thank you.
Good morning everyone, I am Rachel Mariano and today we will tackle about different birthing methods. The first one is natural childbirth. What is natural childbirth? Natural childbirth is a giving birth using no medication at all, instead using techniques such as relaxation and controlled breathing for pain. For many, having a natural childbirth isn't about being brave. It's about treating labor and delivery as natural events. Many find the experience, despite the pain, empowering and rewarding. The second one is vaginal delivery. Vaginal delivery is the safest for the fetus and the mother when the newborn is full term at the gestational age of 37 to 42 weeks. Vaginal delivery is prepared considering the morbidity and mortality associated with operative cesarean birth has increased over time. Approximately 80% of the single-tone vaginal deliveries are at a full term via spontaneous labor, whereas 11% are preterm and 10% are postterm. Of note, with the advent of operative delivery modalities and surgical delivery modalities, the number of patients who reach spontaneous labor has decreased over time and the induction of labor has increased. And the third one is home birth. Pregnancy and childbirth are natural life events and most women will have a natural birth. If you have a straightforward pregnancy and both you and the baby are well, you might choose to give birth at home. If you give birth at home, you should be supported by a registered midwife, doctor, or nurse who will be with you while you are in labor. If you need any help or your labor is not progressing as well, it should your midwife will make arrangement for you to be transferred to hospital. And the fourth one is the Lamaze method. The Lamaze technique, also known as the psychoprophylactic method, is a form of childbirth preparation that was popular in the 1950s by a French obstetrician named Ferdinand Lamaze. Lamaze techniques natural childbirth coping techniques including comfort measures, relaxation, and breathing. Pattern breathing is used to be the hallmark of Lamaze. Today, the method incorporates conscious breathing and relaxation among the other principles. The fifth one is water birth. A water birth is a warm bath might help you relax and help you feel more in control. Floating in water helps you move around more easily than in the bed too. Some science suggests that the water may lower chances of severe vaginal tearing and it may improve blood flow the uterus. The study result about this point isn't clear. Last one is cesarean section. Cesarean delivery or C-section is a surgical procedure used to deliver a baby through incisions in the abdomen and uterus. A C-section might be planned ahead of time if you develop pregnancy complications or you've had a previous C-section and are not considering a vaginal birth after cesarean or VBAC. Often, however, the need for the first-time C-section does not become obvious until the labor is underway.
Good morning, everyone, especially to you, ma'am. I am Magda Gabriel F. Ofenilio, and I am here to discuss to you about on how labor and delivery are initiated and controlled. We all know that childbirth is an important milestone in a mother's life. The mother must be calm and free of stress for effortless labor and normal delivery of the baby.
First stage of labor.
Firstly, we have the early latent labor phase. So this stage, your body prepares itself for childbirth. The cervix becomes thinner and softer and dilates about 3 cm. The contractions are 15 to 20 minutes apart and generally mild.
So early labor lasts for about 8 to 12 hours. You will experience cramps and pain in the lower back and the tightening of your pelvic muscles. your water may break too. By this time, rushing to the hospital is not required. By controlling it, drink plenty of water or eat snacks. If early labor begins at night, then try getting some sleep. You should also stay calm. Keep yourself active with household chores or a mild form of exercise. And of course, stay hydrated. And also, you can record the time gap between two subsequent contractions. Next is the active labor phase. At this stage, the labor begins in full swing. Everything from the contractions to the pain picks up pace.
So the active labor usually lasts for 3 to 6 hours. The cervix dilates about 10 cm.
The contractions are longer and the time gap between two contractions lessens. By this phase, you should visit the hospital as soon as you can, and then by controlling it, you should walk or take a warm bath, continue drinking plenty of fluids, use a pillow to support your abdomen during the contractions, and adopt relaxing and breathing techniques. Next is the transition phase. In this phase, this is the bridging phase between the first and the second stages of labor. The transition is a crucial phase and you need to be prepared to deal with a lot of pain. So the transition phase lasts from a few minutes to few hours. The cervix is dilated and ready to give birth. Contractions happen with little to no gap. You may experience being nausea. And so during this phase, you should go for an epidural if the pain becomes unbearable.
Here's how epidural is done.
An epidural during childbirth is an injection into your lower back that temporarily blocks pain from your waist down. You'll be asked either to lie on your side with your knees tucked into your chest, or to sit upright and lean forward. This opens up the space between the bones in your spine. Your anaesthetist will carry out your epidural in two parts. Firstly, a small amount of local anesthetic is injected into your skin to completely numb the area. Then, a hollow epidural needle is given into your epidural space. This is the space just outside the membranes that surround your spinal cord. When the epidural needle reaches the correct spot, your anaesthetist will thread a very thin plastic tube through the center of the hollow needle. They'll then remove the epidural needle, leaving just the tube in place. The tube will run from inside your epidural space to the outside of your body. It's secured using adhesive tape and used by your anaesthetist to give you medicines for pain relief when you need them. Your anaesthetist may also attach a pump to the tube, so you can top up your pain relief when needed, and sometimes you'll be able to control this yourself. When you no longer need pain relief, the tube will be carefully removed and the area covered with a plaster.
Until the second stage of labor happens and the baby will arrive. Then followed by the third stage of labor, and then the last stage or the fourth stage of labor where the baby and the mother have skin-to-skin contact.
Positive feedback mechanism that occur during labor.
Hey guys, good day everyone. I am Lady Junesh Belsidejos. I was asked to explain the positive feedback mechanism along with some examples. So let's jump right in. I think the first step to knowing the positive feedback loops is to understand why they occur. So why? Why does our bodies through this mechanism of feedback loops? Well, I have one word that should answer your question.
Homeostasis.
So
So what is homeostasis? Homeostasis is the stability of the body's internal environment, and there are countless amount psychological processes that our bodies undergo every day to maintain the state of balance. The body's internal environment is made up of something we call variables. These variables could be things like body temperature or the chemical components in our blood and other body fluids, and if one of these variables was become imbalanced, we may begin to feel sick or imbalance ourselves. For example, if we have too much sugar in our blood, we may begin to feel confused, dizzy, or even nauseated. Here's another way you can look at it. Each cell in our bodies has a small amount of fluid surrounding it. If one of these variables, such as the amount of fluids surrounding the cell or the chemical components in the fluid surrounding the cell, become too thick or too salty, it may be hard for the cell to function properly under those conditions. So our body must maintain internal stability so the cell in our body can do their job properly. Positive feedback mechanism. Positive feedback mechanism are rare. It amplifies changes rather than reversing them. The release of oxytocin from the posterior pituitary gland during labor is an example of positive feedback mechanism. Oxytocin stimulates the muscle contractions that push the baby through the birth canal. The release of oxytocin results in stronger or augmented contractions during the labor. The contractions intensify and increase until the baby is outside the birth canal when the stimulus to the pressure receptors ends. Oxytocin production stops and labor contraction cease. Positive feedback mechanism controls self-perpetuating event that can be out of control and do not require continuous adjustment. In positive feedback mechanisms, the original stimulus is promoted rather than negated. Positive feedback increases the deviation from an ideal normal value. Labor is interesting. Example of positive feedback. So the first contractions of labor push the baby's head against the cervix, which is the stimulus. Stretch sensitive nerve cells in the uterus would send message to the control center in the brain, in turn causing the pituitary gland to release the oxytocin hormone will cause smooth muscles of the uterus, which would be the effector in this case, to increase contractions. As contractions push the baby further down the birth canal, the cervix will stretch even more. And remember, we said that positive feedback reinforces the initial change in variables, which would be the contractions and the stretching of the cervix. We also said that positive feedback results in more something, which would be the oxytocin hormone. So this contracting and stretching of the cervix is going to get stronger and stronger, and oxytocin release will increase more and more until the baby is born. I mean, think about it. If the body is trying to get back to homeostasis, negative feedback will not really help this process. The body needs a quick and rapid response to deliver the baby out of the birth canal. Alright, that's all for today. I really hope that you've learned about this topic. Thanks for watching.
Assessments for newborn babies. Each newborn baby is carefully checked at birth for signs of problems or complications. The healthcare provider will do a complete physical exam that includes every body system. Throughout the hospital stay, doctors, nurses, and other healthcare providers continually look at the health of the baby. They are watching for signs of problems or illness. Assessment may include the below: Apgar scoring. The Apgar scoring helps find breathing problems and other health issues. It is part of the special attention given to a baby in the first few minutes after birth. The baby is checked at 1 minute and 5 minutes after birth for heart and respiratory rates, muscle tone, reflexes, and color. Each area can have a score of 0, 1, or 2 with 10 points as the maximum total. Most babies score 8 or 9, with 1 or 2 points taken up for blue hands and feet because of immature circulation. If a baby has a difficult time during delivery and needs extra help after birth, this will be shown in a lower Apgar score. Apgar score of 6 or less usually mean a baby needed immediate attention in care. And there are signs. Score is equal to 0, score is equal to 1, score is equal to 2. Heart rate absent, below 100 per minute, above 100 per minute. Breathing effort absent, weak, irregular or gasping, good, crying, muscle tone, flaccid, some flexing of arms and legs, well flexed or active movements of arm and legs, reflex or irritability, no response, grimace or weak cry, good cry, color, blue all over or pale, body pink, hands and feet blue, pink all over. Birth weight. A baby's birth weight is an important marker of health. Full-term babies are born between 37 and 41 weeks of pregnancy. The average weight for full-term babies is about 7 pounds or 3.2 kilogram. In general, very small babies and very large babies are at the greater risk for problems. Babies are weighed every day in the nursery to look at growth and the baby's need for fluid and nutrition. Newborn babies may often lose 5% to 7% of their birth weight. This means that a baby weighing 7 pounds, 3 ounces at birth might lose as much as 8 ounces in the first few days. Babies will usually gain this weight back within the first 2 weeks after birth. Premature and sick babies may not begin to gain weight right away. Most hospitals use the metric system for weighing babies. This chart will help you convert grams to pounds. Converting grams to pounds in ounces. 1 lb is equivalent to 453.59237 grams, or 1 ounce is equivalent to 28.3499523 grams, and 1000 grams is equivalent to 1 kilogram. Measurements. The hospital staff takes other measurements of each baby. These include head circumference. This is a distance around the baby's head. Abdominal circumference. This is the distance around the belly or abdomen. Length. This is the measurement from the top of the head to the heel. The staff also checks these vital signs. Temperature. This checks that the baby is able to have a stable body temperature in a normal room environment. Pulse. A newborn's pulse is normally 120 to 160 beats per minute. Breathing rate. A newborn's breathing rate is normally 40 to 60 breaths per minute. Physical exam. A complete physical exam is an important part of newborn care. The healthcare provider carefully checks each body system for health and normal function. The provider also looks for any signs of illness or birth defects. Physical exam of a newborn often includes general appearance. This looks at physical activity, muscle tone, posture, and level of consciousness. Skin. This looks at skin color, texture, nail, and any rashes. Head and neck. This looks at the shape of head, the soft of spots, or fontanelles on the baby's skulls and the bones across the upper chest or clavicles. Face. This looks at the eyes, ears, nose, and cheeks. Mouth. This looks at the roof at the mouth or palate. Tongue and throat. Lungs. This looks at the sounds that baby makes when they breathe. This also looks at the breathing pattern. Heart sounds and pulses in the groin or femoral. Abdomen. This looks for any masses or hernias. Genitals and anus. This checks that the baby has open passages for urine and stool. Arms and legs. This checks the baby movements and development. Gestational assessment. The healthcare provider will check how mature the baby is. This is an important part of care. This check helps figure out the best care for the baby if the dates of pregnancy are uncertain. For example, a very small baby may actually be more mature than they appear by size and may need different care than a premature baby needs. Healthcare providers often use an exam called the Dubowitz or Ballard examination for each. The exam looks at the baby's skin and other physical features, plus the baby's movement and reflexes. The physical maturity part of the exam is done in the first 2 hours of birth. The movement and reflexes part of the exam is done within 24 hours after birth. The provider often uses the information from this exam to help with the other maturity estimate. Physical maturity. The physical maturity part of the Dubowitz or Ballard exam looks at physical features that look different at different stages of a baby's gestational stage. Babies who are physically mature usually have higher scores than premature babies. Points are given for each area of assessment. A low of 1 or 2 means that the baby is very immature. A score of 4 or 5 means that the baby is very mature or post-mature. These are the areas looked at. Skin texture. Is the skin sticky, smooth, or peeling? Soft, downy hair on the baby's body or lanugo. This hair is not found on immature babies. It shows up on a mature infant but goes away for a post-mature infant. Plantar creases. These are creases on the soles of the feet. They can range from absent to covering the entire foot. Breast. The provider looks at the thickness and size of breast tissue and the darker ring around each nipple or the areola. Eyes and ears. The provider checks to see if the eyes are fused or open. They also check the amount of cartilage and stiffness of the ears. Genitals. Male. The provider checks for the testes and how the scrotum looks. It may be smooth or wrinkled. Genitals. Female. The provider checks the size of the clitoris and the labia and how they look. Maturity of nerves and muscles. The healthcare provides the 6 checks of the baby's nerves and muscle. A score is given for each area. Typically, the more mature the baby is, the higher the score. These are the areas checked. Posture. These look at how the baby holds their arms and legs. Square window. This looks at how far the baby's hands can be flexed toward the wrist. Arm recoil. Arm recoil. This looks at how much the baby's arm or spring back to a flexed position. Popliteal angle. This looks at how far the baby's knees extend. Scarf sign. This looks at how far the baby's elbow can be moved across the baby's chest. Heel to ear. This looks at how near the baby's feet can be moved to the ears. When the physical assessment score and the nerves and muscle score are added together, the healthcare provider can estimate the baby's gestational age. Scores range from very low for immature babies to very high score for mature and post-mature babies. All of these exams are important ways to learn about your baby's well-being at birth. By finding any problems, your baby healthcare provider can can plan the best possible care.